Hello, doctor. How are you today?
Fine, thank you.
Today we are going to have some questions to answer our followers that they are very interested to know about. Today's subject is about Intrauterine Insemination Treatment, IUI. Our first question is going to be, what is insemination treatment?
Okay. Insemination treatment is one of the first steps of infertility treatments. It's easy for the patient and easy for the doctor also. It doesn't have a very high success rate, but it's the first step fertility treatment in many of the cases, not all.
Okay. Who can receive vaccination treatment or insemination treatment?
The insemination treatment at the initial admission, when the patient comes to us, if she's young, if she's having a good egg reserve, if the partner's sperm count is fine, if the tubes are not blocked, then the patient can have intrauterine insemination as a first-line treatment.
How is insemination treatment is performed?
Okay, when the patient comes to us, we just first check the steps I told you before. We just check the patient's egg reserve, the egg count by hormone tests like AMH tests. The most important determining factor for success rate is the age of the woman. So we learned about the medical history and the patient's all the details. And then we check the sperm count and the spermiogram test. If the progressive motile sperm test is fine, if the man has more than 5 million progressively motile sperm in the initial checkup, then the HCG test, which checks the tubes, is fine. Then we start with the treatment. The treatment can be done with oral agents for ovarian stimulation or with the injectables. That depends on the couple's characteristics. If we start with the oral pills, then we give the pills at the start of the period, like 5 days, twice a day. If we're planning to give the injections, we give them like every day with a small dose of gonadotropins. This will last, the egg stimulation will last like 10 days. In this 10 days period, we check the patient with ultrasound if she's growing any follicles, any eggs. If the eggs are ready, we do a shot trigger to trigger the ovulation, and then we give a constant time for the couple to do the insemination. That is done in the IVF center. The man comes earlier, he gives us a sperm sample, we wash the sperm, we get the motile sperm cells, and then we make it ready for injection. And when the woman is ready with full bladder, under the ultrasound guidance, we put the sperm cells inside the uterus to see it by the ultrasound guidance in the correct place. Then the treatment is over. The woman will have the HCG test, the pregnancy test, like 12-14 days later. The treatment is over.
What is the difference between insemination treatment and in vitro fertilization?
Insemination treatment, as I said before, is the initial step treatment. It is for young couples with everything fine. But IVF treatment is something else. In the insemination treatment, we just grow the eggs, 1 or 2 eggs at most, and then we put the sperm cells inside the uterus. IVF is something else because we get the eggs outside of the body, we take the sperm cells out, we do the fertilization, the production of the embryos outside in the laboratory. Then we implant, then we put the embryo inside the uterus in later stages. So the fertilization and everything is outside is IVF. Everything is done very similar to natural conception is IUI. It's completely different. Success rate of IVF is always much more higher. IUI gives you the most chance, like 20% for each cycle. But if the sperm count is lower, it can give you a lower success rate. With IVF, you can have 60% or more pregnancy rate at the initial step.
What is the success rate of insemination treatment?
Yeah, it is, as I told you a little once before, the IUI treatment success rate depends on the age of the woman and the motile sperm count of the men. If both are fine, the maximum success rate is like 20% per cycle. But if you cannot achieve pregnancy in the first step, you can have this treatment in 3 to 4 times more. The cumulative pregnancy rate after 4 cycles in young women is like 60% success rate, but each cycle is no more than 20%.
Is there an age limit for insemination treatment?
Yeah, it's not successful over women 38 years of age. The success rate really drops a lot. It is not a must, but we usually choose younger women to get better success rates.
Okay. How long does insemination treatment last?
Like 10 days, 10, 12 days.
Okay. What are the drugs used in insemination treatment?
Yeah, for the stimulation of the eggs, I told you before, we can use pills or injectables. If the pills are used, they can be clomiphene citrate or aromatase inhibitors. They are for producing eggs. But if you choose to use gonadotropins, the injectables, these are called FSH hormones. They are daily-based injections. You can choose them both depending on the couple's characteristics and women's egg reserve.
In what cases is insemination treatment not recommended?
Okay, if the tubes are blocked, if the motile sperm count is very low, if the woman is over 38, 40 years of age, if the egg reserve, egg count is very low, then you rather don't go under IUI treatment.
What tests are performed before insemination treatment?
At the initial step, you have to be young, and then you have to go an ultrasound examination to see the size of the ovaries, the untrapped follicle count. And then you will have hormone tests, AMH tests, or day 3 FSH tests. Then your husband, your partner will have a spermiogram test. And then we need to check your tubes also. That is done by hysterosalpingography. If all are fine, then you can start the treatment.
How should nutrition be before insemination treatment?
If you're obese or overweight, always lose weight before you start any of these treatments related with fertility issues. And if you're smoking, please quit. If you're consuming alcohol, you have to quit. You have to consult all the pills and drugs you're using before the treatment. If you have endocrinological problems like diabetes, your blood sugar has to be regulated before the treatment. If you're having thyroid problems, your TSH levels has to be checked before the treatment. Any medical condition which might negatively affect the treatment results has to be corrected before. So you need a good consultation before starting these kinds of treatments.
Is sexual intercourse recommended before insemination treatment?
It is not recommended, but it's not any harm if you do it.
Is there any pain during the treatment?
No. The injectables might worry you a lot, but these are very small injections with no pain. They are like very small needles, like insulin needles. So it's not painful during this treatment. The ultrasounds are no painful. You will have ultrasounds 2 to 3 times during this treatment. The insemination itself is with a small plastic cannula, the insertion of the sperm cells inside the uterus, so it's also not painful. There is no pain here.
Is anesthesia required during the insemination treatment?
No, normally we do not use any kind of anesthesia, but if you're really worried, if you have some psychological problems related with the sexual intercourse or like vaginismus, or if you're really worried about pain, you can have a little bit sedation during the treatment, but normally always we don't use any anesthesia because you will not need any.
When should daily life be returned after the treatment?
5 minutes later you can go on with your daily life, because nothing you do will change the result. Just don't lift weight, then go on with your daily life.
That means sexual intercourse is allowed after the treatment?
Yeah, that is possible.
Okay. When should a pregnancy test be done after the treatment?
12 to 14 days later, after the insemination is done, you will have a blood test, the HCG test. It's better to have a blood test. Urine test can be misleading.
Are twin or multiple pregnancies possible with this treatment?
Yeah, if you develop more than one follicle, like 2 or 3, then you can have twins or triplets. But the aim in this treatment is to grow only 1, maximum 2 follicles. Twins are very low probability.
Mm-hmm. Is there a risk of miscarriage in the IUI treatment?
The miscarriage rate depends on your characteristics, depends on your age, depends on your medical condition. The treatment itself doesn't increase the miscarriage rate or doesn't affect. How you get pregnant doesn't affect the miscarriage rate. What you're having is affecting the miscarriage.
Is there a risk of ectopic pregnancy after IUI?
Yeah, there is. It's like no more than 10% as in every woman.
What symptoms are typical after this kind of treatment?
If the doctor is giving you some vaginal pills after the insemination, that is if you have developed more than 2 follicles, then we usually just give you some progesterone supplements. Those might cause some abdominal cramps because it makes the bowel movements a little bit slower. You might have some gas cramps in the abdomen. That's all you will have. But using progesterone after treatment is not a must. We just select some cases and just give them progesterone supplements in some of the cases, not all. That might be a side effect of that pill, nothing else.
In what cases should I see a doctor after the treatment?
If you have a good news, like a positive HCG test, you should call the doctor. So she will or he will call you for an ultrasound to show you the gestational sac and your baby. If you already had a negative result, you should consult once more in order to decide to go on with this treatment or something else.
Does IUI treatment work for women with irregular menstrual cycles?
Yeah, these anovulatory women have irregular periods. They usually have delayed periods. So these women might just benefit from this insemination cycles. But if the irregular periods are due to low egg reserve, it's better to have IVF than IUI.
What should be done to increase the success of this kind of treatment?
Just correct your medical issues, lose weight, and your lifestyle changes might positively affect the results. If you're a man with your partner undergoing an insemination cycle, you should stop consuming alcohol, cigarettes, no high heat, like your professional work conditions might affect the treatment or the sperm cells negatively. So you have to consult them all with your gynecologist or in combination with the urologist. All the treatments can be planned after when all the medical problems are solved.
Is it normal to have a bleeding after insemination treatment?
Normally no, because we just put the sperm cells with a soft catheter inside the uterus. The bleeding is not expected. But the bleeding will happen if it's a negative test result after 12 to 14 days when you're not pregnant. This is your period. That's why you're bleeding.
What are the reasons of failure in this treatment?
This is the first step treatment. There are many reasons we don't know after this treatment. If this treatment IUI fails 2 to 3 times, then the things we don't know about you is your egg quality, is the fertilization rate, your embryo quality. Many of these we don't know with the IUI. But if you go on the treatment with IVF, we will know more about you, so we can tell you in more detail what the problem is. But IUI is the first step, initial treatment. It's hard to explain why it is negative.
What are the symptoms of pregnancy after the treatment?
The pregnancy is not detected depending on the symptoms. You should have an HCG test. Don't wait for symptoms to occur to be sure that you're pregnant. Just have the HCG test 12 to 14 days later in blood, so you will see you're pregnant or not. Don't wait for the symptoms. So symptoms might not be certain that you're pregnant.
Thank you very much today.
Yeah, thank you. Bye-bye.